Hello, everyone. Welcome to this session on In Conversation with Dr. Abijit Das. Abijit Das is a managing trustee of Center for Health and Social Justice. Abijit Das has got a wide range of experience in public health, working on issues on reproductive health, gender, social justice. Today, we are here to have a conversation with him on his development practice using participatory process. So we'll get right back into the first question. So, Dr. Abijit Das, so can you just start off the conversation of your discovery of your early discovery of participatory process, research, and your intervention, and how it all started off?
Thank you, Rajesh, first for inviting me to this program and to share my experiences of participation. To be honest with you, I discovered participation as a principle because, I am a doctor by training. So doctors are very directive. They tell patients what treatment to follow. They give health education. But when I went to rural India, I realized that how little I knew about the reality of their lives, how little I knew about their cultural beliefs and practices around food, around living. Why I'm highlighting these is because my treatment had to work in their reality. So with that, I slowly started investigating their life, people's lives, in order to make myself a better healer. But over time, what I realized is that most of the people with a health issue do not come into my hospital. So I started working more on community health. When I worked with community health, I was in an organization that also worked on environmental issues. And they had started working on rapid rural appraisal and slowly into participatory rural appraisal, which was being used for environmental issues. So they were looking at forestry, they were looking at agriculture. And during that time, I realized that, hey, these could be adapted, and this is somewhere in the late 80s, that these could be adapted into, how do you have conversations about health? And I remember one of the first conversations, and we were working on maternal health, is that we were sitting around with elder women, and these were all TBAs. They had come, and we talked about how many children you've had. So each of them said, I have had so many, 3, 6, 7, 5. And I said, how many were living by the time they were age 10? And slowly became this, so they became a bit sad and said, I was 3, I had 2, I had 4. And we realized among that group that they had gone through, let us say, in that group, 100 pregnancies or 100 deliveries, and only about 60 or 70 were alive. And when I asked them, how do you feel about it? So there were conversations, some would say, Bhagwan ka den hai, it's God's will. But I said, how do you feel about it? And most of them would be very sad, thoughtful, and reflective. Was this necessary? Could it be a different experience? And I realized that actually this was a form of participatory inquiry in which, and later I came across books, Helping Health Workers Learn was a good book that I came across, which talked about application of participatory methodology. But in terms of the principles, a book that was very useful for me to understand the principle was Paulo Freire's Pedagogy of the Oppressed. And the idea that you use codes. Codes mean you first have an experience which is beyond their experience and slowly bring it to their experience and reflect upon it. And just as I told you, that this conversation around how many childbirths did you have and their own thoughtfulness, and then they become much more committed, even though their childbirth days are over. But since they were TBAs, they were engaging with new mothers and to-be mothers, and that became an easy way to discuss of what can we do. And so what can we do to keep the mother safe? Instead of coming with my suggestions of you should do A, B, C, D, it was what do you do to keep the mother safe? So to understand from their perspective, what they do. It's not that communities want bad health. It's not that communities want children to die. But the question is, what they do and what we understand as good behavior or good health behavior may not be the same, because we have more data, we have more evidence. But then can they analyze their own experience to understand whether that kind of experience that they had may not necessarily lead to the experience they want, the benefit that they want. So I'm just talking of how the participatory cycle works. And then what else can we do? So obviously, आप बताइए. So is it, हम तो बताएंगे लेकिन आप क्या कर सकते हैं? What can you do? So that kind of experience on very simple maternal health issues, working with TBAs, talking about safe delivery, talking about complication management, that was among my first experiences. And that helped communities to not get disrupted, because I did not at that point say in the late 80s that you all need to come to hospital.
Yeah.
But the emphasis was all women need to have access to a hospital when you have a problem. And this is times long before mobile phones were available. So we had to promise them, if necessary, I will come. If necessary, our hospital, our ambulance or our car will take you to the hospital. I will accompany. So you had to also build trust. Participation requires building trust. Participation requires respecting the community's own existing practices and not rejecting them as good or bad, because often health education is very directive. It tries to tell you that, this is right, this is wrong. So oftentimes what you are doing as your innate practice is shown as wrong. But that was not my approach, because I realized that if I wanted them to improve, they had to be equally invested in it. So using, theoretical principles, using tools, how people could own the new kind of practice that we could talk about. And one interesting thing I learned at that time, and which I realized that nobody knew, was that in the communities, when they cut the cord, they used a coin or a piece of stone or a piece of wood to cut the cord, because the umbilical cord is very slippery. And if you try to cut it, it will slip around. In hospitals, we used scissors, which have both sides. So there's one to support and one to cut. But if you're using a blade, and we would say, blade ubalo. And then I realized that actually the blade was boiled, but there is nothing, we are talking of boiling what is underneath. Yeah. Then we said, use that also. Don't use stone. If you're going to use a stick or use a piece of wood, please boil it with the blade. And then I actually came across the TBA kit of Nepal actually had a piece of wood in it, sealed in the pack, and they had sterilized it and given it. And we in India hadn't realized it, because we never went to the community to understand how they do delivery. Instead, we were only promoting what was so-called technical knowledge. So for me, this sort of very initial experience in the late 80s was very it was an aha moment for me. And from then on, I have always believed that, you can use any method, but you have to build trust. You have to help people to analyze their own reality. Data from books is not necessarily enough. It can give you some clues, but we haven't actually delved deep into cultural practices, and health is all about culture in many ways, because childbirth is a cultural phenomenon. We celebrate. We want the child to survive. Oftentimes, the survival sort of strategies that communities practice and the survival strategies that we as doctors prescribe are completely different. So that's how I discovered it. And the discovery was primarily build trust, help people understand their own social reality, and work with them, provide information where necessary to navigate to the change that is a commonly desired outcome. So that's in many ways my discovery.
From the discovery part, and I know that the late 80s, 90s, which was the heydays of participation, right? And we had all these tools coming up and books coming up and all that. But I just want to dwell a little more on your own practice of, because you're also practitioners and teaching people how to use practice in their own interventions, right? So I also want you to little dwell upon this whole discussion on the tools and the participatory as a philosophy itself, right? And we have seen this practitioners getting carried away with the tools, right? And they say, oh, we did this social map, we did this and everything, and forgetting the philosophy of it, right? And how important it is for practitioners to keep that as a back of the mind, right? And how do you actually envisage this when you are actually teaching practitioners that? How do you actually keep that as a central point in the philosophy of it?
So, Rajesh, as you've said and you correctly pointed out, there is a huge schism between the philosophy or the principles and the practice, which is the tools. Because what happened in between in the 90s is that toolkits started flourishing, and we had toolkits and toolboxes. This is mapping, that is Venn diagram, this is ranking and sorting. We called it chapati sometimes. So that happened, and to a certain extent, that enthusiasm change the focus from what you have pointed out from the principles and the sort of what is the philosophy to just practice. And as I said, in my case, I didn't know tools to start with. I started from my own ignorance and I started from my own need to find a way, so that it was just a discussion and it became a participatory exercise. So if you ask me, I always say tools are subordinate to the purpose. Tools are never the important things, because you can tweak tools for the purpose that you want to co-learn with the participants. Because it's always a co-learning process. It can never be, I used participatory tools as an interesting method to get the information that I wanted. The unfortunate part is that it is an interesting method. People like it because it is usually through exercises. But the thing to remember is that exercises allow people to think. So if the thinking doesn't happen, the exercise itself loses its meaning. Let us say when we are doing, as many of you may know, let us say ranking and sorting. So in order to do ranking and sorting, we first need to find out the options which will be ranked and sorted. So each piece of paper, for example, if we are going to rank and sort or do a vote, it has to be held by the woman, even if she can't read it, and know what it represents. And it has to trigger a chain of ideas or thoughts and memories in her head. Because until and unless that chain of memories, the chain of associated thoughts, chain of images do not happen, the person who is engaging with the process is not engaging with the philosophy. And once they start engaging, then that particular piece of paper, which is a representation of an idea, becomes their own. And then they place it where they want in the ranking or sorting exercise, in this pile or that pile, above the list or below the list. I'm just trying to say how you use a method in a deliberative way to provoke the person who is participating to unlock their chain, unlock their memory, and come to their consciousness. Because at the end of the exercise, they must realize, they meaning the participants here, I'm not being, that they have processed their own information. I, as a facilitator, will be very happy with a new diagram that I have taken, or a new chart that I've taken a picture of, or a new map. But until and unless that map also represents a consolidation and a re-evaluation of the community experience that I was, talking to them with, it is meaningless. And for that, what we have to be prepared is for a degree of uncertainty. For example, I was working with Roma people in Bulgaria. A completely alien reality. The purpose was a health program. And I was talking to the facilitators there. It was a training situation. And they said, teach us tools and methods. I said, I will not teach you tools and methods. Let us examine the reality of the community that we want to work with, where you, I, and the community leaders try to create a common understanding of our reality. And it's only after that, in a training situation, I can help you to match tool to purpose. And we went to this community which was living right next to railway tracks and there problem was like happens. It's a settlement that the municipality doesn't agree with. So there was a huge degree of suspicion between the municipality authorities and the community authorities. They wanted a tuberculosis program to start. So their purpose was tuberculosis program. But once we had gone through and we started the exercise, they ended up with an education program.
Okay.
They said tuberculosis is easy, education is more important, because tuberculosis only requires drugs to be provided to the identification of potential patients and drugs to be provided. But the education requires a far more internalization, a far more acceptance of our society than tuberculosis. We'll manage tuberculosis tomorrow. So what I'm trying to say is the community started, identifying its priorities, how they want to relate with the municipality, and they also realized that actually our children need education, because today they are all begging. I was quite surprised to see, begging in Europe. I hadn't thought about it. So what I'm trying to say here is that you have to be flexible. Here, that organization was flexible enough to not work on a health priority and, starting work on a education priority, because the community identified it is their more important thing. In another Roma community, and I'm talking about the Roma because these were situations in which I was not directly involved. I was working with a organization of Roma who were then working with the Roma, and they were working with public systems in which Roma are considered alien in many ways, like the Dalit in India. In another situation, they decided, we will not do anything. We will take care of the graveyard, the cemetery. And the cemetery has, graveyards and gravestones of the non-Roma community who have all migrated. But we'll start taking care of it. When they started taking care of it, the non-Roma community said, wow, you're doing such great work. And the relationship between the Roma community and the non-Roma community improved. And after that, there was joint planning. So there was no hostility or suspicion between the Roma and the non-Romas. The point I'm trying to say here is that true participation requires flexibility in approach. It needs to promote in many ways in which the community can think through the problem and identify solutions which may not look to us as outsiders the most practical solution at that point in time, but they know their reality. They know how they can solve their problems in a way that is practical. So that kind of flexibility is important. So please don't use it as a toolbox for a definite set of outcomes. Use it for a purpose and be flexible in terms of anticipating. There may be results which you didn't think of. Yeah.
So on that note, I also wanted to look at communities themselves, right? There have been instances when you try to use participatory tools a lot for communities, and communities over a period of time no, I know what you're getting at, right? So sometimes it's also overuse of the tools with the communities themselves, right? But on a larger context of how communities have also grown, right? As what you said, before we had communities who didn't know to read and write, and then the tools made a big impact on how do you want to get their insights into the program. But as communities have grown and media has grown, everybody's got a cell phone now, getting all sort of information everywhere. But how do you actually now reimagine that? Because for me, around the 2000, somehow the practice of participatory tools started going down in a way because of the overuse or a misinterpretation, what you can say. But how do you actually now, in today's context of reimagining participation, right, in communities now, which are totally different from the 80s and 90s. You know? It's a totally different set of young people who are more in tune to the world, getting information from everywhere. So how do you reimagine that participatory process now?
So first, I want to talk about this routinization of participatory methods that has happened. You know, in many ways, people like us who started using it in small scale, and when I say small scale, where flexibilities are possible, they became sort of mandatory in larger programs because we were doing a lot of advocacy. I'm putting myself also in that box. Is when we did the advocacy and public program started having participation as a principle, and then came the large-scale mandatory training and use of tools, because you had to do it quickly, you had to train trainers, like an assembly line. And what happened is that there was, the trainer or the person who's going to be the facilitator in the community, the kind of empathetic relationships that have to be there in order to sort of both co-create the solution, or the how do you approach the problem, that stopped. And it became like, it's an engineering diagram that you have to put in these things. So I think that is where the death knell of participation happened, because it became a procedure. And over time, as you have mentioned, people have changed. So the procedures have become completely irrelevant, because now they know, oh God, they're going to do another exercise, another mapping, another Venn diagram kind of situation. So we have to be cautious that proceduring creates that problem. But the next part of your question, which I think is very important, is to understand the transitions that have taken place from the time in the late 80s, early 90s to now that we are sitting in 2020s, is that communities are not what they were, the problems are not that they were, the technologies are not what they were, levels of literacy, naivete, knowledge have changed. We have a far more fragmented society. We have far more ability to use technology, which creates actually opportunities. But social solidarity, what was there in the 90s, is no longer there. People have been forced to think about themselves. People are, community structures do not exist the way they did. There's rural, if I use the rural example, the rural economic situation or the agrarian situation has changed. There aren't enough livelihoods available in rural India. So in that kind of situation, where you have created more, let us say, fragmented societies, the tools, yes, they need to be applied, but you also have situations where you have to constantly focus on the solidarity. And I would use COVID as an example, where we were forced to think about, we have to live together. COVID forced us to live together. Now, in that kind of a situation, if you don't have the solidarity aspect, then you have further isolation. COVID itself was creating situations in which people had to isolate themselves from others. If you ask me, the message of physical distancing created itself into social distancing. We should have talked of social solidarity with physical distancing, because in a society like India, where anyway there are social distances, it reinforces the message. And there were so many places in which people were not allowed in access, livelihoods were affected, the poor, the marginalized were, I don't want to mention that. So in that kind of a situation, we have to find ways in which the tool itself is not important. You may be using an app, but how do you use an app? How do you use a technology interface that enables you to represent social reality, which represents our common interest? That is a challenge. I don't have easy answers, but we did try certain things. For example, during COVID, all we had is a mobile phone. But what we encouraged people we were working with is to use the mobile phone to create a local network of information, and that local network of information then feeds into the public system to ensure who requires the ration most, who requires healthcare services most. So it was participation in a completely different way from going and drawing charts on the paper, because our concern was, how do you promote social solidarity? And then how do you use the tools that are present? And mobile phone was the tool that was allowing people to join.
Okay.
So that's the way I think people who are talking of participation need to reevaluate their priorities. And participation is about solidarity. Then you use the technology that is available. You use your understanding of where social solidarity today is, and how do you proceed further?
Yeah, so to end it, let me come to an organizational bit in participation, right? See, one is a philosophy of participation where you want to work with communities as participation, right, as a philosophy. Then there is another way in organization itself. How do you actually create a imbibe participation, right? From the leadership down to your community level thing, right? And I'm very sure that you might have faced that situation, right? To say that, oh, we have participation here, but we don't have participation here, right? Because that's the philosophy of it, right? So how do you actually deal with that situations?
So I guess you're talking of a classical dilemma in a small organization.
Yeah.
Because in a small organization, oftentimes it is leader driven. So it's one person who has, sort of taken the initiative to step out and create an organization. That one person initially creates the institutional mission. And then as an institutional operational principle, we are talking of participation.
Yeah.
So how do you balance between the two? I think one is to recognize that both are necessary. There are situations where leadership is a situational crisis management may not be done with participation as the first platform. Yes, it may be, but sometimes when you have a group, you can also get into groupthink. So how do you sort of balance between groupthink? How do you balance between groupthink and innovation? How do you create distribution of power? The problem in hierarchical structures is consolidation of power and decision making. So can people start participating in the decision making process? Can people also understand that there is delegation? Because participation doesn't mean everything has to be sorted out in a collaborative platform. Functions can be delegated to specialized functions. And then when you delegate, you have to also accept. We can't delegate as a as an aesthetic value, and then when it comes to the crunch, you say, you've given your solution, but I will take the action. So it requires trust. So trust, delegation, innovation, I think those principles are equally important along with participation, because participation is essential but not the only principle for moving forward, because innovation is required. You need agility. I remember an example that one of in a college situation I was asked, our class was asked, which is a better plane, a fighter plane or a jumbo jet? You can't answer that question because both are purposive. A fighter plane needs to be agile, whereas jumbo jet needs to be stable. Institutions need direction to change when in a crisis, but they need to take everybody together in terms of their routine operations. So I would say participation is like the jumbo jet. You need to have everybody together, but sometimes you need to navigate difficulties and where individual ideas can be important. But the team should be able to sort of talk to each other with respect. Without respect, it doesn't happen.
Okay. Well, with that thing, we conclude the session. Thank you, Dr. Abijit Das, for this wonderful session and to come to our university and give us a wonderful time which all the students had.
Thank you. Thank you so much, Rajesh. And thank you all.